Julius Tumwine is the lab expert team lead and the connectivity focal person in NTLP Uganda. Today, he's going to be discussing the use of connectivity to link X-ray screenings and laboratory diagnostics. Without further ado, I invite Julius to present.
Thank you, the moderator. Good afternoon, good morning, and good evening, everyone. My name is Tumwine Julius, and I lead the team of developers and other implementers in Uganda that are building a connectivity solution that we call LabxpertsDS surveillance, or DS for abbreviation. So today I'm going to be taking you through the use of connectivity to link X-ray screening and laboratory diagnostics. Next slide, please. Yes, next one. Yes, so some of the abbreviations that we might see in the presentation include NTLP, which in this case would mean National TB and Disease and Leprosy Program, NTLL, which is National Tuberculosis and Reference Program, RIF, which means rifampicin, MDR, which is multi-drug resistance tuberculosis, and MWRD, which would be molecular WHO recommended rapid diagnostics. Next one. Yes, so significant investment has been made in all TB disease burden countries in connectivity recently. And these connectivity solutions would help us in sending, aggregating, and processing data from multiple instruments that are used in the laboratory. And this can help us in monitoring performance, instrument networks in real time, troubleshooting the utilization of the instruments, looking at reagents and forecasting stock, and also looking at the results for patient management. So it is therefore a WHO and NTLP priority in Uganda, for example, that all MWDs testing sites should at least have a data connectivity solution that is able to transmit results electronically to clinicians and patients. Next one. So this led to the birth of LabXpert, which is a web-based platform. This supports automated data capture. Here, when I talk about automated, it means it is able to pick data automatically without anyone entering this information, as long as there is internet connection. So far, we've been picking data from GeneXpert machines, TrueNat, Aphenion, by Abbott, and now we've done the integration with the digital X-ray. So this, of course, helps us to be able to monitor our equipments in real time. We are able to know which equipments are working, which ones are not working, which ones are well utilized, which ones are not being utilized, which ones are having stocks, which ones are out of stocks. And at the same time, we are able to pick results and relay them to the clinicians and patients in real time. This automated relay is very helpful, most especially in cases whereby the samples are referred from lower facilities to the testing sites, which in most cases are central testing sites. So we are able to send results in SMS format, and as a result, this helps us to reduce the turnaround time of these results. The next one, please. Yes, so in terms of linkage of the lab and the X-ray, this is the process, how it looks. So you have on your left, we have the X-ray, the digital X-ray, in this case, which would be having the card for TB. Then we have a central system. In this case, we have LabxpertsDS. Then on the right, we have now another system, which would be the lab equipment. It can be TrueNat, it can be GeneXpert, it can be any instrument that you are using for diagnostics. So what we do, we make sure that we have a patient identifier. So when they are capturing patient details on the X-ray, we capture in this patient identifier. It can be a unique patient identifier that is generated from a lab information management system or any patient management system, or it could be a barcode in case you don't yet have a system that is able to generate for you these unique identifiers. So when they capture in this unique identifier with the rest of the information, it is uploaded to LabXpert as long as there is internet connection. And even if there is no internet connection at the time of record keeping, at the record capture, as soon as there is internet connection, this result is automatically synced in to LabXpert. So we send now this sample to the lab with the barcode attached to the sputum container or the request form. And then we train the lab technicians also to capture in this patient identifier as the specimen ID in the diagnostic equipment. So also, as soon as the testing is done on the equipment, the result is also uploaded to LabXpert, and then LabXpert has the background job that is already there that matches the two IDs, and it is able to show you that this patient who was tested, who was screened with digital X-ray, this was the result from the lab. Next one. Yes, so in short, the requirements you need for this linkage, it would include the unique patient identifiers, which can be a barcode or any system-generated identifiers. Then you need internet connection on both the X-ray and the lab equipment. Then you would need a central system. In this case, in our case, which is LabXpert, where both systems are able to upload their results. The next one. Yes, so briefly, I'm going to show you a bit of a demo of LabXpert. You can go to the next page. Yes, so this is a screenshot of LabXpert. As you can see, we show you the equipments that are already connected to LabXpert. We have GeneXpert, we have TrueNat, Affinion, and the different results. The results that are coming in from different equipments. Next slide. Yes, so this is the portal for X-ray. The first part shows you the X-ray devices. So you can be seeing a list of all your X-ray devices that are connected to LabXpert and the last time they last uploaded. So like I've said, this can be real time as long as there is internet connectivity, or in case there is a problem of internet connectivity and maybe you are syncing in this data once a day, it is still okay. The system will keep track of when the device last uploaded the result. Next one, please. Yeah, so the other part is now part of the individual patient scores from the card. So the system would be able to show you all the details from the card, including the symptom and clinical information. And this helps you to get also an online backup of your systems. And then the other thing is that if you are the administrator or you have a central permission, you can be having access to all the card systems in the country that are located in different places in just one portal. You are able to see, oh, this is from this facility, this is a patch, this is the central system, this is from where. In one tool, you are able to monitor and see. And this begins now the part which we talked about of utilization, because now we can aggregate for you this data in a simple dashboard, and you're able to see of which systems, card systems is being well utilized, which one is not being well utilized, and you can be able to follow up different systems. Next one, please. Yes, so the other thing that we can do, we can be able to now also capture the images. And what we have seen is that now you can come up with a quality management system in this case, whereby maybe once a quarter, you can randomly pick system tools that images that were analyzed by the card for TB, and you send it to different radiographers that have access to the system. They also analyze and they upload their results, and you are able to compare and see. So this can actually work as a quality management system. You can set it to say, maybe every quarter or every month, I want radiographers in the country together with the card for system to analyze the random pictures that I choose. But also, in case you have maybe other cases of the images that are taken and they are not for TB, and maybe you have scarce radiographers that can analyze these systems. So what we have seen is that now we can use LabXpert and make sure that those radiographers have access, so that if a system is, an image is taken from up country, but we have one radiographer who is in the city, can be able to access the system, analyze, and send back the result. This can be for other complications apart from TB or any other just related images that are already analyzed by CAD for TB. Next one. Yeah, then like I've said, you can have summary reports from every site. You can see how many were screened, how many were having scores. You can choose the threshold here by yourself. Maybe I want to see scores beyond 50%, those below, the ones which are not actually images. So one other thing is that when we started picking data from the sites, we realized that this is where you can now also understand how the equipment is being used. Because as if you have seen on the first slide, which was showing the results, you have seen their scores which show -1. And that is when those images are not for the chest, but the radiographer sends them into CAD for TB. So they are being analyzed with the AI, which is meant for the chest when they are legs, skull, and those other images. So also the system helps you to pick up those other images that are being captured that are not for images, but are sent in for the AI analysis. Next one, please. Yes, so this is now the last part, which would be the core of our integration, whereby now for each patient, we are able to show you the CAD scores, but at the same time, we can show you the lab results and the X-ray site and the lab where the analysis was done, and the date for the X-ray and the date for the gene expert. So this one image has a lot of information packed in. First of all, this helps if you want to give access to the clinicians that have requested for these tests. They can have both the screening and the lab results in just one page. Secondly, you can be able to see, in a case the system is being used in the community for outreaches, you can be able to pick results from multiple laboratories and bring it to one page for a site. So for example, if you have, this is a patch as an X-ray site, but they go to the community and they end up sending these samples to different gene expert sites, they don't need different accounts to get from different laboratories their results. By just logging into one account of theirs, they are able to pick results from different laboratories and they can summarize it. And then the last part you look at is the X-ray and the gene expert or the lab date. So this is where now we can be able to come up with turnaround time. You can be able to know how long does it take from screening to getting the laboratory results. So this one page has a lot of information and a pack that you can analyze either in the system, or if you want to download it and maybe take it in Excel and do multiple other analysis. Next page. Yes, so this is what I was talking about in case you wanted to look at the analysis and the different dashboards that we can analyze for you. Next one. Next one, please. Yes, so this is the last part which I would just smuggle in. Since we're already talking about AI, I wanted to highlight that also we have input AI in LabXpert, but this is specifically to help us monitor the lab equipment. And also in future also we intend to, I think, add the digital X-ray in terms of maintenance. So what we have seen is that these equipments, they tend to break down, and we know when they have already broken down, and the process of repairing them takes a long time. So we have built an AI model that is able to keep on monitoring the errors and the different notifications that are from these machines, and it is able to notify us at least 2 months ahead before like a gene expert module is breaking down, so that you start on the maintenance process before the machine actually breaks down. So I thought this was, since we are talking about AI, it would be an important part to add in, and since maintenance of this equipment is of paramount, this is something that we can think about. Thank you very much. I think that would be my last slide. So in case you need further information, that's my email. We can continue to get in touch. Otherwise, thank you very much, Delft, for organizing this interesting webinar.
Thank you. Thank you, Mr. Julius. It was really insightful. Data connectivity is a hot topic. And I think your presentation today helped a lot of people understand how they can use it to strengthen their healthcare system.